Dementia care is evolving. Recognizing the limitations of traditional healthcare, a new approach is finally emerging. Yay! This approach focuses on the whole person living with the disease and their caregiver. Imagine specialized support accessible from home, proactively addressing the complexities of their specific condition. You're going to want to join us as we dive into the future of dementia care, uncovering innovative solutions that promise better outcomes and a more sustainable path forward. Welcome to Fading Memories, your source for all things dementia caregiving. I'm your host, Jen Fink, and I have had 3 generations of loved ones with dementia, and I'm here to share the knowledge I've gained with you. Welcome back, Fading Memories listeners. It's Jen Fink, your host. Thank you so much for joining us today. Today we are talking about some improvements in dementia care, which we all know is very, very necessary. And with me is Sabrina Chugani. She is from Remo Health. She is a co-founder and chief officer there, where she oversees partnerships, marketing, and account management. Just a few things to do. She has developed a deep expertise in value-based care and has spent her career working at the forefront of innovative payment models, including MSSP, CKCC, and direct contracting that changed the way care is delivered nationwide. And I'm going to put a link in the show notes so that you can learn more about Remo Health. But now I want to toss it over to Sabrina and say thank you for joining me.
Oh, thank you, Jen. What a pleasure. We're big fans of the podcast. And first of all, that's just too kind of an introduction. So
Thank you. So I understand, on top of being a founder of Remo Health, which you're going to explain a little bit, you also have your own personal background with dementia care.
yes, I do. I can tell you a little bit about my journey, how I even ended up here. I've been, like, as you know, in healthcare my whole career in a variety of contexts. I became very singularly focused, Jen, on improving access and healthcare delivery for vulnerable populations. And before Remo, I worked on slowing down the progression of kidney disease at a company called Cricket Health for people on Medicare and Medicaid, which was just a profoundly meaningful experience. What inspired me to join Remo was the shared experience that my co-founders and I have. When we met, I was really struck by just how similar all of our stories were, right? We couldn't be more different in terms of our backgrounds. I'm Indian. I actually grew up abroad. I didn't grow up in the States. And many of my family members, their first language is not English. So when I met my co-founders, I just, like I said, couldn't be more. I was totally struck by how similar our stories were, because in the context of dementia, though our backgrounds were different, our stories totally the same, right? All of us struggled to get our loved ones diagnosed. We felt helpless without answers or good guidance, and managing the condition really devastated all of our families. In my family, my grandfather died with dementia, and it was beyond stressful. It was painful. It was heartbreaking for my grandmother, for my dad. And again, my family's Indian, so like my grandparents' first language is not English, which is part of what made getting answers and just simply receiving any type of clarity, let alone care, was all the more challenging. And so when I think about that a lot, because every part of our story, if our family should have been different, could have been different. I wish I had been different, and I carry that with me every day here in doing what we do at Remo. So we believe very fundamentally that families deserve better, and that's what we're delivering.
We definitely deserve better. And it's interesting that you participated in like kidney health care, because my dad passed away from kidney failure. Because he was one of those diabetics when he was diagnosed with diabetes, he's like, I'm going to eat what I want and die happy. Well, I guarantee you that is not what happened. And the toxins from the failing kidneys, of which he had 3, because he also had a kidney transplant, the toxins basically poisoned his brain. So at the end of his life, his memories were all scrambled up. So I had two parents with
Oh,
no brains. It was lovely.
God. It it's interesting. There are a lot of parallels actually between what I was doing at Cricket and how we were slowing down the progression of kidney disease and the problem of dementia, particularly in the context of kidney disease. It is a highly undiagnosed condition.
Mm.
Most people find out that they have it when they crash into dialysis, is the term that's used. And as with dementia, like the person living with dementia is doesn't have as much insight into what is happening and what is changing for them. And so a lot of the intervention that we deployed when I was working in the kidney space was education, empowerment of the person living with kidney disease. What we're doing, what we need to be doing to really move the needle in dementia care is education, empowerment centered around family caregiver. And so that's something that's a core piece of our care model at Remo.
Well, that's one of the other things that I do. Besides the podcast, so let's see, in January 2019, I became a volunteer with the Alzheimer's Association. I started with legislative advocacy. So I go advocate with legislators, mostly on the state level, but I have been to DC once. I'll probably go back again, but I'm going to wait a while on that one. Then I became a support group facilitator, which is great. The people that are part of my group, they really don't need me. They are so supportive of each other. It's wonderful. And then a little over a year ago, about a year and a half ago, I started doing community education, and that's been a lot of fun. So earlier this week, I actually gave a talk on the warning signs of Alzheimer's, and I told my staff partner at the Alzheimer's Association, so that's actually the person that gets paid. I refer to myself as a professional volunteer. I said, I'm just gonna basically Frankenstein this slideshow and take out all of the videos and like all of the extras because I have so many stories. I super struggle to keep it to an hour.
Oh my goodness.
And I always feel so bad. At least this last time, it's like there was a clock right across the room. It's like, talk faster, like get it moving. And the gal that booked the presentation told my staff partner, "Oh, I learned so much." I'm like, "Oh, thank God." It's like I I know I have a lot of really cool stories between what I learned with my mom and what I've learned with talking to people like you. So it's been like it's really hard to
It's hard to condense it all.
yeah, because it's like they're all instructive. One of the gal that booked the program has a neighbor that she loves dearly, and she's 99% certain his wife's got a cognitive problem. And they're both in denial. And I'm like, oh, can I talk? I could talk for an hour on denial. So part of the educational process is having conversations. So I opened it up with, my mom had Alzheimer's for easily 20 years. Her mom had vascular dementia, and my great grandmother, maternal great grandmother, also had dementia. Yay for me. Great family history. So a lot of people ask me, are you going to do the blood test that just got released, or do the genetic testing? And it's like, probably not, because I already do all the lifestyle choices. That is like when I got a new general physician last year, that's what I told him. Like, that is like 99% of all I care about. Like, we don't have female cancers. I don't smoke, so I don't really worry about my lung. It's like brain health, brain health, brain health. Then we care
Brain
about
health, brain health, brain health. I mean, and I think, well, and first of all, let me say, Jen, just thank you for the work that you are doing, because the community advocacy and j just talking about it is is we're not doing enough of it. So I really thank you for your work. It's so important. I think to your point about brain health, brain health, brain health, I couldn't agree more. I think where we are is, it's similar to where we are with dementia today is very similar to where we were with cancer or HIV 20 to 40 years ago. So we're far behind the curve, right? There are no curative treatments on the market. We cannot reverse this condition. But what you and I know to be true is we can prevent cognitive impairment by adjusting our lifestyle factors. And how do we do that is we need to be thinking and talking about brain health in the same context of of our kidney health or our heart health, right? Or you do things in sort of maintenance mode to keep your heart healthy, to keep your kidneys healthy, to keep your lungs healthy, right? Um, I don't smoke because I want to keep my lungs healthy. And we're not thinking about uh since joining Remo and building this business, I think about it more than ever now. But I think 5, 6 years ago, if you asked me like, oh, I didn't get a lot of sleep last night. I'm working, I'm busy. Um, sleep is for the weak. It's like, no, no.
Yeah, that phrase, you can sleep when you're dead, is like, well, if you don't get enough sleep, that might come sooner than you'd planned. So before we get totally like off on a 2 hour conversation, which I just demonstrated I'm really good at doing, tell us all about Remo Health.
You bet. You bet. I would love to. I would love to. I think, like I said, this is my co-founders and I came together because of the similarity across our stories, right? In the context of dementia, we're all the same. It doesn't matter where you come from, what you look like, what resources you have. It's the same journey for folks today. And that journey is riddled with, confusion. And so we fundamentally believe families deserve better. That's what we're delivering, right? I can tell you about Remo in the context of it being the greatest honor of my career to bring this service to folks those are folks that need it, right? No matter where they are, no matter what language they speak. Um, so what do we do at Remo? So we deliver evidence-based care to both the person living with dementia and their family caregiver. Maybe that's caregivers. We deliver that care virtually because most Americans can't take a day off work to get to an academic medical center in their area, or just a local neurologist, right? Most Americans cannot afford to take a full day off work to take their loved one somewhere. Um, and that's disruptive to the psyche, to the routine. So it's important to us that care is delivered virtually. Um, that care is also delivered by an interdisciplinary care team led by neurologists and geriatricians, because delivering an accurate diagnosis is really important to us. If you don't have the right diagnosis, you don't have the right care plan. And that is what informs the answers and the guidance that you get. And so our care teams, they're led by doctors, right? So neurologists and geriatricians, and they include care navigators, nurses, social workers, and pharmacists. And so that team works in concert with each other, right? You've got pharmacists working collaboratively with nurse, working collaboratively with care navigator, so that we can keep the dyad, which is the patient or person living with dementia, and their family caregiver. We want to keep that dyad supported across the entire journey. And we want to manage coordinating back with their primary care doc. Like it's our job to oversee everything related to their cognitive impairment and their dementia journey. And so that's a little bit about what we do. And I think the only other thing I'd say is we think about caregiver support very differently here. Meaning it's integrated in our care models. We've built a library of resources to help families answer any question that they may have. And the resources are all medically reviewed. I think to the point that we made earlier about just educational assets and awareness, there are not enough places to go to get sort of centralized, um, valid answers to questions about what reliably is going to happen across this journey. And so we've built that and have made it really scalable and consumable. Want to make it really easy for families, no matter what language you speak, and no matter what device you're using to get answers to these questions and get that guidance from world-class dementia specialists at your fingertips, right? And so last thing I'll say is it's not enough to get guidance and help from experts, because that exists. You got to patch it together in a world without a Remo, but people also want to connect with others on the same journey. We just talked about the benefit, the value of, people want to connect with each other.
Mhm.
And because being a spousal caregiver comes with a completely different set of challenges than being an adult child caring for their parent, right? It's a completely different experience.
Mhm.
So we have over 20,000 people in our community connecting with each other to offer that peer support, which is usually what folks need most to feel supported. just to know that they're not alone, right? Someone else has lived this and wants to offer them either just somebody a kind word or a helpful tip that worked for them, right? Hey, I saw this with my mom. Oh, you're dealing with wondering. Yep, we're going to see that with this type of dementia. And I know it sounds crazy, but in my household, we put an Apple AirTag in my loved one's wallet. And it just gives me peace of mind to know where dad is, because I know he's been prone to wondering. So that's how I've managed it in my household. Like, what have you tried, Jen? And that there's no intervention from us there except that we're facilitating that conversation and connecting people with their peers.
It does help because there's so much. I don't like the Facebook groups. I didn't find them, excuse me, very helpful, but I have not been a huge fan of Facebook for a very long time, so that's probably colors my opinion. But the prayer hands emoji and all that, it's like sometimes people just needed to vent and that's fine, but it's everybody's journey is so different. And people would say, well, oh, this is what you need to do. Like, because it worked for them, they just understandably assume it would work for everybody. And like my mom didn't wander. I was like, well, one thing she didn't do. But there was one incident where my grandmother was cared for by my aunt, who was the youngest of the 4 kids. Out of the blue, they pull into the driveway. My grandmother, who at the peak of health and adulthood was probably barely 5'3", like myself, and shrank with age as many women do, flings open the car door and starts running down the street from their neighborhood towards a major road. And of course, my aunt is caught completely off guard. And, that few seconds of complete and utter shock, it's just like a little kid, man. My grandmother got so funny for her. And, my poor aunt was just like panic and chasing after her and yelling,
it's terrifying.
Yeah. And it was just like, I don't know how, I think my grandmother probably ran out of breath. But
Yeah.
my aunt probably didn't do much better, but oh my gosh, just, I can't imagine. And I'll have to ask my aunt how she resolved that. But, my aunt could definitely have used more support. And my grandmother passed away in 2012. So there was less online stuff. There was way less podcasts because I think there might have been one. There might have been 0. Trying to think. I don't think there were podcasts in 2012.
I bet there were 0. Right. I mean, a lot of what we did, I mean, if you want to distill down what is our intervention, it's we have built technology that allows that allows the time and space for empathy to occur in a visit with our clinicians or on a call. So part of our model, Jen, includes like 24/7 access to our nurses. So in the case of your family, in that instance, right, runs out into the street. I mean, that's terrifying. That's really triggering. Okay, we as a family mitigate this. But you want to make a call to somebody and say, you can tell you want to do a couple of things. You probably want to vent to somebody else that has
Like,
lived
what the heck?
Oh my God, like this just happened to me and I'm scared. I'm scared and I want to know, is this expected? Has anybody else seen this? What can I do to do right by my loved one? Because that's all we want to do is just I want to know that I'm doing everything I can to support my loved one. And most people just want to talk and get on a call and say to someone who is a medical professional and say, hey, is this all right? Is this expected? What can I do differently next time? Do we need to go to the ER in the case of what we see happening a lot with the families we serve, Jen, is with hallucinations, which is a symptom of sort of Lewy body dementia. Hallucinations can occur, particularly around the time when sundowning happens. And you want to be able to call somebody and say, is this what should I do about this? Right? This is my mom. This is my husband of 50 years. I know something, this is strange. I'm not sure what to do. And the de facto answer today in a world without a Remo is I'm just gonna take my mom to the hospital, right? Just take her to the hospital, try to get answers that way. And what we're doing is really trying to meet people where they're at, connect them with the resources when they need them, and make sure that they have all facets of support available. So not only can you call a medical professional and say, is this expected? What can I do? Do we need to go? Should we go to the hospital? Right. And have that conversation with a nurse. And then also be able to say to somebody else that is an adult child caring for their mom, hey, this is, I'm in my 30s, I'm in my 40s, and now my life is really revolving around taking care of my mom. There's a bit of a role reversal here that I'm experiencing, and it's challenging. It's challenging. So that's what we offer. And even that may get pretty far talking with another family caregiver that's in the same position. But what you may need then as a caregiver yourself is it may behoove you to get some sort of like CBT, have a more therapy focused conversation on what does that mean for me as an adult child and my relationship with my mom, and how we age together. And so that's why social workers sit on the care team at Remo, is because we want to make sure that we can provide that support to family caregivers as well.
So in the case of my aunt, after she wrangled my grandmother back in the house and calmed down from the complete panic that she experienced, if she had called you guys, she would have been able to talk to a clinician who might have said, like, her first reaction may have been, oh my gosh, I need to get her to the hospital. What's going on? And we all know that that's generally not the best place to take somebody. And at best, air quotes, they probably would have given her like an antipsychotic, which
Yep.
aren't great all the time. Maybe they're necessary, but you'd be able to talk through like maybe why that happened, ask some questions. See, that's what our doctors aren't trained for. It's like,
And there's no time. There's no time, right? These visits, appointment slots are squeezed. There's primary care docs are doing their best, but they're doing everything. And even our specialists, right? If you're lucky enough to get in to see a neurologist or a geriatrician, those slots are also squeezed. So we've exactly to your point, and we've built a service and we've built technology so that those conversations with a provider, so someone on Remo's care team, can really be about shared decision making, right? How do we talk about what your loved one wants? How do we restore agency back to people and help families enable their loved ones to age independently in their homes for as long as possible? That's what everybody wants. Everybody wants to live independently at home for as long as possible, right? Nobody wants to be at the end of their life hooked up to lines, wires, and tubes. No one wants that, right?
no.
And very few older adults in America go the way that they want to go. And so it's really important to us, exactly to your point. Like, yeah, you can call a medical professional, you can talk to somebody. We are with you every step of the way. And part of that includes planning for the future, planning for what comes at the end of life. And actually, the more proactive you are about that, if you're actually doing that in concert with, we've just received a diagnosis, let's start to put a plan in place to honor mom's wishes or aunt's wishes or like whoever it is. Let's like put a plan in place and have a hard conversation about what matters to them, right? This is geriatrics in motion. What matters to you, so that we can codify that and honor that as your care team, and make sure that your family carries out those wishes.
Well, it's also beneficial to discuss. So my mom always said, well, I don't want to be a burden, but I'm going to live in my home forever.
Yep.
Great. Thanks. We never had, like, you think my family would have been prepared because my mom and my grandmother's dementia overlapped. Zero prepared. Stupid. It's like, I still want to like go back in time and like smack people around, because it's like, my mom started showing the signs when I was in my 30s. My daughter was very little, and it was just enough to try to like deal with everything that was going on because we had a family business together. But the fact that my dad's health wasn't great and we never had a conversation like, what'll happen with mom if dad goes first? Like, that should have been like the most we should have this conversation. We never did. And it's one of the reasons why I am on the biggest soapbox about you have to have conversations about what if, and here's how I want to spend the last, decade or decade and a half of my life. My paternal grandmother lived to 103. So how do I want to live from 85 to 100, right?
Yes.
And if I want to live in my home, independent, whatever my wishes are. I'm not stupid. I think it'd be great for somebody else to do a lot of the cooking and cleaning and taking care of activities. I've seen the benefits of that, so I don't know. I don't really know what my long-term wishes are. I kind of do. But if my wishes aren't, we are able to fulfill them, like we moved from a single-story house with wide hallways to a house. The majority of the stuff is important stuff's on the first floor. My office is downstairs. My crafty room, my everything room is down here. And it's a narrow staircase, so getting a stair lift would not be super easy, although they have new varieties. But it's like, it's a long driveway to take the trash out. There's a lot of stumbling blocks for living here till 103. We've discussed them, but what if we can't stay here till the end, then what? Or if your dementia progresses to the point where I can't physically take care of you anymore, then what? These are the conversations we need to have early, because I fully believe, and it's backed up with a guest who married her husband after his Parkinson's diagnosis. Still, yeah, I still think that was nuts, but because they had these conversations, her fears, his wishes, her wishes, how she saw providing care, how he saw receiving care, and the what ifs. They had obviously multiple conversations in the earlier stages when he was still able to do these conversations and make these decisions and choices.
Yes.
She very vehemently felt that he was easier to care for because he knew that she was following what he wanted and what they'd discussed. Like,
Absolutely.
kind of instinctive, I think, at that point. So
Absolutely. I mean, you hit the nail on the head, Jen. And why are those conversations not happening? Right? There's a couple of reasons. We don't have good awareness about cognitive impairment, dementia. Most people, there's a huge proportion of people coming into our community that say, what's the difference between Alzheimer's and dementia? So, I mean, we're really needing to address sort of the awareness issue. And then when it comes to what kind of care you can get within the healthcare system today, there just isn't time. There isn't time. Ask a person living with dementia or any type of cognitive impairment, right? What matters to you? What's important to you? How do you want to age? And then there's not good guidance on. And if that's the case, here is what we should start to do. Here's the paperwork we should start to put in place. Here's how we should think about making sure your caregiving team, which is your family, knows what to do and knows how to optimize the home, right? And there is a lot of low-hanging fruit, right? I think what you talked about, where it's like there's just distance from door to driveway to take out trash, or things like, just, we got a house full of throw rugs. I'll give you an example of I'm Indian, so we have a lot of closeness to like Persian culture. There's a family we're working with. Yeah, Persian families have a lot of Persian rugs. This is a part of the culture. It's beautiful. There are a lot of Persian rugs in the house. That's a fall risk for someone living with cognitive impairment. Immediately, let's figure out a plan to get those out of the house. What we can put them on the wall so they still enjoy their beauty, but this is the type of thing that this is exactly, Jen, what our care team does, right? So you meet with a geriatrician, you can have a conversation about what matters to you, meet with our social worker, meet with our nurses, and immediately, because we focus a lot on delivering really culturally competent care, can understand for the type of family we're seeing, like what are the questions we need to ask? What are the things we need to think about? And how do we empower the family to have that conversation? That is what you're describing is just really difficult to do. There's no place to do that in the healthcare system today. And we don't guide people in that way. at all. And so that's really what we've designed the entire service around: restoring agency, empowering family caregivers, and making sure that they have a guide with them to yeah, to age as optimally as possible.
Well, let's walk through the steps. So I actually have a couple of new members in the support group I facilitate that are on the beginning stages of this journey. I mean, there's some people in my group that their person's gone now. So we span the entire journey in our group, which is beneficial, but so I recommend you guys to these two people.
Yeah.
And what they know what well, does she have I think one of them may not exactly have a formal diagnosis. My mom was really good at avoiding being diagnosed. By the time she was actually diagnosed, she was literally like mid stage of the mid stages.
Oh,
Like
it's really hard to have that conversation. And primary care is not doing anything wrong. There just isn't time, and they don't have the tools or the resources to make a dementia diagnosis. So it's yeah,
they're getting closer because now
we're getting closer with the blood test. We are getting closer, and that's such a incredible advancement. And even just with the news about the blood test, right? We can talk about it more. So I'm improving awareness day over day, but we are getting closer. But it's a pervasive problem, right? Most older adults, I think the stat, Jen, is like only 16% of older adults get a cognitive screen in America. And it is recommended as part of the annual wellness visit.
It's covered by Medicare if you're
covered by Medicare. We should be doing it, but we're not. And that's part of the problem that we're solving. So to your point, what would that journey look like for a family that came in to work with Remo? Every part of the journey looks different than care that's available today. And so it starts with diagnosis, right? Today it just takes a long time to get to diagnosis, right? There's denial, there's the orchestration of take the day off work, go to the neurologist, even just long wait times to see the right docs, lots of appointments, right? Have a PCP visit, maybe get referred. That referral doesn't land for hey, we've got a wait time of 9-12 months. So it's hard to get diagnosed. So what do? We help families get to diagnostic clarity as quickly as possible. So you can come in and see a remote doctor within a couple days to a week from signing up. And that happens over Zoom. So just as we're doing right now, you can see a remote doctor and meet with them to get as close to diagnostic clarity as possible as we can. And in some cases, we need to do labs, look at images. In some cases, we don't necessarily need all of that to get to diagnostic clarity, but our care team delivers you a diagnosis. And again, that's a conversation you're having with a geriatrician or a neurologist, right? So these are the folks that can very accurately and efficiently diagnose dementia. Once we deliver that diagnosis to a family, our care team is building a personalized care plan for that family caregiver and the person living with dementia. And it will include their entire family as well, right? Sometimes there are multiple caregivers involved.
Yeah.
That may not live in they may not be co-located. That's why Zoom provides this opportunity to involve the full family if needed and if that's appropriate. I know for my family, again, we're Indian, we're multi-generational household. So if I'm caring for my mom, my brother and his girlfriend and like 8 people are going to show up on that Zoom call. And that's okay. And we want that, actually, whatever it takes to get the family aligned, to get to clarity on what's going to happen next. And so we build a personalized care plan for the family. And what does that mean is we deliver kind of answers, right? So we deliver that diagnosis. And I said earlier, right, having the right diagnosis is how you get to the right care plan.
Mm-hmm.
So what is on that care plan? On that care plan, we're connecting you to the resources that we have on our platform in our library. So if the diagnosis is Alzheimer's, we're connecting you to resources on agitation. This is what you may expect. Like, this is what you should expect, and this is what you can do about it. We're arming family caregivers with the answers and guidance that they need to manage that journey, right? So that care plan has resources that they can come back to at any time. The care plan also has a couple of different steps depending on what they need, right? So the next step for them may be meet with our social worker to do advanced care planning. The next step may be meet with our pharmacist, right? So once we see a family, we are running a lot in the background to make sure that we're learning everything that we can about that family. So they're not having to tell us their story from scratch, right? We can pull medication lists. And so we can quickly arrive at what do we need to do for this family based on what we know about them and their unique social and medical needs, right? So if they're on a set of medications that they shouldn't be on because these medications may be accelerating cognitive decline, it's our pharmacist's job to say, we're going to get you off the Benadryl. We're going to stop that. That's dangerous. And here's why. And talk about that and actually engage in a conversation of why, because so often in healthcare today, there is not a conversation about why. It's just, hey, stop the Benadryl. There's not time. So we're really making it very intentional to have that conversation. So it's meet with a neurologist, geriatrician, and then who you meet with next is just based on what we know about you and your sort of risk that we're imputing on our side. Um, and then what we do is, yeah, proactive planning for the future, right? So that's done with the social worker. That's also done with the doctors on our team. We want to help them know what's going to happen next and understand what matters to mom, dad, spouse, so that we can honor that and proactively put those things in place. So I'd say if I distill it all the way down, what it starts all the way from diagnosis, that's different. And then we're with you through the entire journey, all the way through end of life and even beyond. And so we are your one-stop shop. So we've got the resources you need, that community support we can connect you with. Hey, you're a spousal caregiver, and I want to connect you with a group of other spousal caregivers in your region. You can connect with them on virtually. So we're managing all parts of the journey. And then our care navigators close that loop with any other providers that this family is working with, right? It's our job to close that loop. It is not the onus should not sit on the family to have to patch together and stitch all of these new providers and make phone calls and call the insurance company. Like we it's hands off from the family and hands on from Remo. And it's fully dyad centered, right? So everything we do puts dyad at center. And so we're supporting that family caregiver as much as we would support the person living with dementia.
That sounds wonderful. I definitely will tell these guys about it because I'm a once a month. So my support group that I do is via Zoom. We have people from every end of the state of California. It's kind of wild, but it gets challenging when like one gentleman, he wants to know all the like research and the who's and the what's and the whys. And it's like, I have another gal that just looked at him and said, it's not going to change anything. She's very blunt about it in a very sweet and loving way. She basically let him know you can learn all that stuff. And I do think a lot of that is beneficial, but it doesn't change the fact that the journey is still really hard.
Hmm.
And I think his wife's in denial. It's complicated, and I don't want to get too detailed because I'm sure he doesn't want his story spread everywhere. So
It's complicated. It's really complicated. I think that's again what we're trying to restore to folks is like it's complicated. It's okay to talk about it here, and we're going to help you through it. Um, no matter how long it takes, right? And I think that's what's been really amazing about where we are today. Um, is we may have talked about this offline, but the government has just introduced an alternative payment model for dementia. And what that really means is we're actually entering a world where dementia care is this is a value-based payment mechanism for dementia versus a traditional fee-for-service oriented payment structure for dementia care, which is really what we should have always been doing for these families because it takes time to have those types of conversations. And to our earlier points, right? Sometimes it's just I just want to vent about how difficult this is. And now I need answers, but I need both. And it may take 2 hours for us to have that conversation. That's okay.
it helps that, and this is where our traditional healthcare system doesn't work, is the providers, like my GP, I know he hasn't had any dementia training. I'm trying to figure out how to make that happen for him. Like, I can help help the people in this office. Just figure out how to get past the gatekeepers on that one. But he doesn't, like, when I would take my mom to the doctor, the GP that she'd had for years and years and years left the practice, and we got this very nice younger doctor. I'm sure he was great. He was totally useless with my mom because he would listen to her, and I would try to answer the questions he was asking her under my breath so he could hear me, but she wasn't aware that I was correcting her, because obviously that's rude. And, you don't do that to your mother, right? And I never got the sense that he really paid any attention. Whereas her neurologist, and I joke about this regularly, she would look at my mom and talk directly to my mom. It was as if I totally did not exist, but I could make a comment and you could almost see her ear like a cat turning towards me. Never acknowledged me, never turned a little bit like to hear. No, you could just, I know human ears don't work that way. I think hers did. And she was the only doctor who said, I know this is hard. You're doing a really good job. I must have looked like hell.
No, I'm sure you did. It's just that acknowledgement of caregiver. That's what we're missing, right? In tradition, every traditional EMR, the electronic medical record, there's not even an affordance for who is the family caregiver. So how do we treat the condition like that? We've done families a disservice, because keeping that caregiver supported, educated, empowered, informed is the only way to move the needle for improving outcomes and improving quality of life for person living with dementia. So that's what's tremendous about the guide model is where the federal government is saying we're incentivizing healthcare providers, primary care docs, neurologists, geriatrics, anybody that sees older adults and may encounter cognitive impairment. Federal government is saying we're incentivizing you to stay laser focused on the dyad and diagnose dementia, give families clarity that they need, and then support that caregiver, because that is the number one way to keep that person living with dementia safe at home and out of the hospital, which is what we're all after, right? Is how do I age independently for as long as possible, is avoid those hospital visits when you don't need to be there. Right? We talked about this earlier, but for like a woman of 5'2", 5'3" stature, which is my stature as well, right? And particularly, the older you get, the more frail you may become. A hospital visit for someone in that situation is a toxic insult to an already fragile brain. You're more likely to lose one or two of your ADLs, your activities of daily living, by going to the hospital. The safest place for someone living with cognitive impairment is for them to stay safe at home, surrounded by their loved ones. So that's what we need to be optimizing for. And we're thrilled. We are really thrilled about the federal momentum here, because it makes what we're talking about, what we're finally aligning incentives. So there's a place to go to talk about this, and that's Remo. And what's amazing about the guide model is it makes all of this type of care that we're talking about, this transformative support for family caregivers and evidence-based care for people living with dementia. It makes all of that free. So there's no copays if you're eligible for the government program. There's no copays, and there's even an added bonus, if you will, of a respite allowance. So I'm not sure if you're familiar with respite. I think respite has a bit of a branding problem. Like, people that, when you ask them, do you know what respite is? They'll say, I have no idea what that is. And when you explain to them what respite care is, they're like, that sounds like it would be incredibly helpful for me. I really need that. So the government is saying you've got up to $2,500 to use to get a break, because what reliably is very bad for people living with dementia is if their caregiver burns out,
which happens a lot. So
all the more.
I am super dialed in. You should see my news push notifications. I swear. It's like prevention, women's health. I get all these things like, don't, cardiologists won't eat these things for brain health. I mean, it's like, it's crazy. And I have never heard of the guide. So, and, again, professional volunteer with the Alzheimer's. Why are they hiding this information?
It's a great question. It's a great question. Well, the federal government isn't like a market. They're not a marketing engine.
No.
So I think the onus really is on the guide participants, and there are about 300 or 400 of them nationwide. So there are a lot of guide participants, and to be a participant, you have to be enrolled in Medicare. You have to be able to treat Medicare beneficiaries, and you have to deliver this type of care. So if you applied and got accepted, which is what we did, you can now deliver this type of care, and the government will pay for it. So I don't expect the government to be, a marketing engine, but the onus really is on Remo and the other participants to spread the word, drive awareness of the program and its existence, and say, come on in, we can care for you, and all of this is free. It's covered by the federal government. Come in, get a diagnosis, get clarity, get the answers that you have probably needed for a long time. And yes, there's this bonus of the respite care allowance, which is tremendous, is going to be tremendously impactful for people. The hard part is, to your point, like making sure folks who are eligible know that it's an option for them, and then help them find a guide participant. So we're on that path, literally having this conversation and making folks aware of it, even if like, a couple hundred people uh, learn about it today in this moment, then there's a nice effect of word of mouth, right? So the more people that know, the more people that will tell other people. This affects all of us, right? It's extreme. Honestly, find it extremely difficult these days to go anywhere where and talk to people that haven't been touched by dementia. So, you either are living it, are noticing it, or are have friends and family members dealing with it. It's because, well, modern medicine is doing its job. Modern medicine is working. We're all living longer. So the government really needed to do something such that we're, again, like paying for dementia care in a completely different type of way, and doing the thing that we've always needed to do, which is put family caregivers at the center.
Yeah, which definitely has not been the case. And, I can hear people be like, oh, well, it's so expensive, but it's like, it's more expensive if you've got somebody with dementia that's in and out of the hospital and parts of their family are burning out or leaving the job for it. I mean, it affects so many different aspects of our society. Like our corporations are already losing institutional knowledge because people have to retire earlier. They have to work part-time instead of full-time, which is difficult if you're in your 30s and 40s, because now you're lessening your retirement income. It's just, we're like, I hope this is going to put a stop to the financial generational trauma that just keeps getting passed down. And
Yes, the cost of unpaid caregiving to the economy is astronomical. We're talking billions. Then the cost of dementia care as it stands also in the billions, right? Almost, I think, $300 billion is the stat. And if we don't do something different as a nation, we are on track to bankrupt Medicare by 2050. These numbers will top $1 trillion in terms of cost of dementia care. So it is a big part of the reason the government introduced the payment model is once a family decides we're going to put our loved one in long-term care, that's anywhere from $80,000 to $100,000 a year, and Medicaid foots the bill for that. So the government looked at the data and said we have to do something different, and what that is incentivizing providers to deliver sort of evidence-based interdisciplinary care models where you can call someone 24 hours a day. Hey, do I need to go to the hospital? Yes or no? And empower caregivers, right? It's everything that the guide model is wrapping up in one, and like allow caregivers to take a break, like actually finance that, give them an allowance so that they can rest so that they don't burn out, because we need to be really focused on that. And so that's the whole impetus for the guide model is financially we're going about this in completely the wrong way.
No, definitely. And the $2,500, if you're smart, if you're a frugal blonde as I am, I would take $200 a month and find someplace so I don't live very far from Lake Tahoe. Go rent a cabin for the night. It might be a little more than $200 in Lake Tahoe, but
Yes.
something like go to the day spa and just spend like the whole day getting, massage and your nails done and, just pampered. You don't have to like take a week off because that could actually be stressful to leave your loved one in somebody else's care. But yeah, it's like I would totally, I would, I would maximize the benefits of that $2,500. Anybody wants any ideas? You know how to get a hold of me. I will give you ideas. And it benefits if you do it my way, it's going to benefit your local community as well. And it's like, it's, it's like you said, right now we're going the wrong direction with how to pay for all this stuff. And, if we're focusing everything on the family, then that's focusing on the local community. And oh my gosh, so much better. I'm still shocked I haven't heard about this guide until you guys came along.
Oh, we've got a lot of resources. So we can link them in this podcast. We've got a ton of resources. We all need to be on a shared mission to make more people aware of it, because it's truly, I mean, these are transformational government benefits that will, I mean, what we've heard already, the program hasn't been, the program launched about a year ago. What we have heard from folks that we're working with is, I mean, this has completely changed my life, right? Just being able to see a dementia specialist whenever, being able to call a nurse whenever, having education at my fingertips that's credible, having everything in one place, being connected to my local community-based resources. Like this is everything that the guide model asks us as a provider to do. There are requirements that we need to adhere to, but the reaction of families we services has completely changed my life. I didn't think this type of care was possible, and I've been struggling for years, right? It for many families, it's challenging well before a diagnosis is sort of solidified and cemented.
Yep, I was there.
Yeah, we've got to do better. So I'm really excited about the federal momentum here, and we'll get the word out together.
Awesome. Well, that's a great place to end. And as the listeners should know, but I'll remind you, the link to Remo Health is in the show notes, and you can go find all about them and their education. And you're assuming you have stuff about the guide on your, yeah.
We do. We have plenty of stuff about the guide model. If you're interested in receiving care from our care team, please come on in. Let us know. You can schedule an appointment. We'd love to meet you, and we're here to help. Like there's always something we can do together, and you're not alone. Like that is the take home message. That's why we exist.
And somebody that they don't have to be in the early stages. Like I could have come in with my mom and she was closer to the end.
We work with families, Jen. This is a great question. From pre-diagnosis all the way through end of life. So it doesn't matter when you come to us. Like I said, there's always something that we can do. Pre-diagnosis is like, I don't even know if I have a problem, but something feels off. I will help you get clarity. And hey, I've got a diagnosis. This is on a trajectory that I can manage it, but that doesn't make it any less difficult, right? There's still a lot we can do to be helpful there.
Awesome. Well, I appreciate this, and I'm definitely going to spread the word as much as I possibly can because this is very exciting. It's like finally, I mean,
Yes.
it's like I think my mom's been gone for a few years, so it's like I'm beginning to realize, like, oh yes, my mom and my grandmother's dementia did overlap, and I was technically a sandwich caregiver because we had the family business, and my daughter was in school, and I was trying to manage my mom because I've told people, oh, I missed the sandwich caregiver stage. No, actually, I did not. So it's like some of those details are starting to
They
like,
come back when you have a moment to I know it's, oh gosh, that's it's hard. It's I can't imagine. Just really, Jen, thank you for everything that you're doing for the cause, and how you approach this conversation today. I think this is like the exact right way we should be talking about the problem, and how we enter the solution space together. It's going to require collective action from, people on the Hill,